Well, when it comes to your eyes, new non-surgical technologies and treatments are opening the door for patients. And June is Graves' Awareness Month, a good time to know about these new treatments. Dr. Raymond Douglas joins me now from Thrive Health right here in Las Vegas to talk all about the new possibilities for treating these conditions. Doctor, welcome to the show.
Thank you so much.
Let's start out by chatting about autoimmune and thyroid eye diseases. What are you seeing?
Well, thyroid eye disease, so that everyone knows, is an autoimmune condition often associated with Graves, where the immune system attacks the thyroid in the eyes. And what I see about patients who have this autoimmune condition that affects their thyroid and bulging of the eyes, causing pain, discomfort, swelling around their eyes, primarily in women.
Oh, interesting. Okay. Let's talk about how it's diagnosed. The symptoms you mentioned, weren't super pleasant. How is it diagnosed exactly?
Well, anyone with an autoimmune thyroid condition, such as Graves' disease, should probably be screened because about 80 to 90% of thyroid eye disease is associated with Graves' disease. So that's the first thing. The next thing is, well, do you have chronically red eyes? Are they changing? Are they bulging? Do people notice that you're staring all the time? Those are things that you're going to outwardly see, but can take a long time to change. And people might attribute those to allergies, etc. But a lot of times it can be chronic inflammation from thyroid eye disease. And the best thing to do is to see an ophthalmologist and start with an eye care professional.
Certainly. I mean, it's important, right? Because this condition affects people's bodies and it affects their daily life.
So much. I couldn't agree with you more. 80 or 90% of my patients will actually change their daily life. They won't go outside. They'll get up early just so that their double vision or that their eyes get a little bit better before they drive to work. But it severely impacts both their social and functional lives tremendously.
Well, doctor, we can't have that, can we? We're going to talk about the infusions that you offer at Thrive. But first, tell me what treatments have previously been available for folks.
Yeah. So when you have bulging of the eyes and this inflammation, we really didn't have much before a few years ago. What I would have to do as a surgeon is I would have to remove tissue from behind the eyes or drill down the bone from behind the eyes. Not
Ooh.
exactly what someone wants to sign up for. So the medical treatments have been a real, innovation for how we treat these. And I've certainly spent about the last 15 years researching them, and it's dramatically changed how we approach patients and patient care.
Awesome. Speaking of patient care, let's talk about these infusions. They're providing comprehensive care to your patients right now.
Yeah, and that's really the key is this is a relatively rare, disease, and it really requires a hands-on approach because many people will have different symptoms. So we really try to provide a concierge approach, making sure that we offer all options, including these infusions. And when we do start the infusions, they're often as a series every few weeks, and we make sure we monitor patients really carefully. And these aren't just, infusions that decrease the immune system. They're very, very targeted to decrease the disease. And patients often see remarkable progress very fast. But we also want to make sure that the side effects are under control. And that's something we really watch very closely.
Excellent. Doctor, real quick before we go, can you expand a little bit more on how these biological treatments work?
Yeah. So again, we've spent many, years in research, and we've identified what the target is that the immune system attacks. It's a little receptor around the tissue around the eye, and the immune system attacks that receptor and kind of turns it on.
Mm-hmm.
Kind of like having your thermostat on all the time, and it just increases these tissue expansion and inflammation. Well, this drug blocks that receptor and kind of
Yeah,
turns that thermostat back down and reprograms the immune system. So it's a pretty remarkable targeted treatment.
that is remarkable. Doctor, thank you so much. You're a great guest, and it was very interesting to chat with you here. We're going to push our viewers to your website if they'd like to learn more. Great to talk to you.
Thank you so much.
Absolutely. For more information on everything Dr. Douglas and I just discussed, visit the website right there on your screen. You can also visit their socials.